Hey everybody, Dr. Quirk here with an interesting MSK case I've seen within the past week here. I had a patient present with posterior elbow pain. He was a teenager, older teenager, around 16, 17, and he had posterior elbow pain, and he happened to be a high-level pitcher who pitched year-round. So here's his MRI that was performed, and we can see here we have an axial T1, a fat-suppressed T2, and a sagittal fat-suppressed T2, and I'll give you just a second to take a look at it. Unfortunately, there's already an arrow on there, so that's the main finding. Just take a second to think about what you might diagnose it as. All right, so this is an olecranon stress fracture. So this patient presented with posterior elbow pain. He's a pitcher, so let's kind of think about first stress injury. So fatigue fractures may be stress injuries or insufficiency injuries. What's the difference? Well, a stress injury is going to be the result of overuse or abnormal stress on normal bone. So young patients who are overusing a specific joint, they tend to be more in the lower extremity than the upper extremity. But they do happen in the upper extremity, particularly in baseball players. They'll happen at the elbow, or they can. Little league or shoulder is a similar type of phenomenon, but that's a physeal injury. Insufficiency fractures are usually in our older patients. Think of them in the sacrum, particularly, and they are the result of normal stress on abnormal, usually osteopenic or osteoporotic bone. Kind of talk quickly about the throwing motion. There are all these different phases that include wind up and arm cocking, acceleration and deceleration, and follow through phases. If you're not that interested in MSK, you probably don't need to know all of those different phases, but just know that there are certain injuries that can occur during the pitching motion, and if you think about the kinematics that are occurring at that particular time, the injuries do make sense. Usually, the bones are the main stabilizer to valgus stress at the elbow at certain degrees. So it's usually, I think, 0 to 30 degrees and of flexion, and then above 120 degrees, you're going to have predominantly bone. But in between there, it's going to be more soft tissue. And so that's what leads to a lot of these common injuries that we'll see in throwing athletes. So you get a significant valgus force across the elbow, the medial elbow, whenever you are going through the pitching motion, and then you'll get compressive forces on the contralateral, or the other side, on the radiocapitellar side. Like I said, primary restraint during your throwing motion is your ulnar collateral ligament, but the joint capsule and muscles happen to be secondary restraints to help, because with every pitch you approach the maximum amount of force that the UCL can handle before it fails, and so those secondary soft tissue structures play a large role. The most important part of UCL injuries is going to be poor mechanics and overuse. So these kids who go year-round playing baseball, like I said, each pitch approaches the required force for failure of the ligament, and over time that will lead to ligament weakening and then failure. Other things you'll see in these athletes, there's something called valgus extension overload syndrome that's mostly seen in overhead athletes. As these medial soft tissues begin to fail, you start to get more instability in this ulnotrochlear articulation, which you can see on this axial arthrogram image here. And as you start to decelerate after you've thrown the pitch, that instability leads to shear forces across the posterior elbow here. And so you can see this bracketed area is some significant cartilage loss there. The arrow is kind of pointing to his UCL tear, where that ligament is abnormal in signal and a little bit lax looking. And then you can even see right here there's a little bit of osteophyte formation. So this may also play a role in the development of an olecranon stress fracture. Other things you'll see in these athletes, ulnar neuritis, It can be from in isolation or along with the other soft tissue injuries because of just adjacent inflammation. There are a few things to think about, like a ligament of Struthers, which would be a congenital abnormality, Anconius epitrochlearis, which is an accessory muscle. It can get compressed between the two heads of the flexor carpi ulnaris. But what ends up happening is this repetitive overhead motion can directly compress the nerve, or you can have just inflammation from the UCL tear, valgus extension overload injury that irritates the nerve itself. So a lot of these pitchers will also go on to have an ulnar nerve transposition. Other osseous abnormalities that we may see, you'll see compression at the radial aspect, like I talked about at the very beginning, which leads to repeated impact of the radial head against the capitellum. So you can get stress fractures over there. In a kid, it's called Panner's disease whenever this occurs. So you get this osteochondrosis of the radial head, of the capitellum, not the radial head. And then what we've talked about, the olecranon stress fracture, which could be directly from valgus extension overload from triceps constantly pulling on it, or posteromedial impingement. So a lot of the images came from this article. You can use the link or you can use the QR code if you prefer that. Thanks for listening.